my fingers, wrist. So right now it's just feels open, feels expanded. I'm in shock. Exactly why I came to this dude. So I'm definitely getting the treatment I need.
Hey RECVR family, I'm Dr. Bobby Thrush, owner of the RECVR brand. I'm here in downtown Miami at the BOXR facility. One of my clients called me up and said, hey doc, I'm having some ankle, knee, hip, and wrist pain. This is great for people who fight. Excellent. Gets a blood flow, it increases range of motion. If you're jabbing, if you're doing any type of sports that you're using your hand a lot, this is great.
Ridiculous.
So that's what we do at RECVR. We make client-centered treatment tailored to each and every single individual.
In boxing, I'm always using my quad, so this is definitely relieving a lot of tension from you having to get low to dodge those punches and roll and slip, move out of the way. Lots of explosiveness. Yeah, it's building up now.
So he's in the gym right now, so let's go in, let's check him out. So right here is compression therapy. What we're doing is that we're actually trying to enhance tissue gliding. So that helps the muscles move, loosen up range of motion. So for him, he's having some tightness and some pain. And right here, this is very, very important because it's gonna actually enhance blood flow right to the area, right to the knee. What it is, it's not like your typical resistance band by any chance.
I've just been feeling a lot of tension and pressure built up in the knee, making me feel unstable. After I start warming up, it goes away, but once I cool down, I feel the pain come back and I start limping and I can't really support myself.
The knee specifically is a stability area. So for example, the knee's a stable joint, ankle is a mobile joint, the foot is a stable joint. So a lot of people, they overuse those joints and they're not as stable as they were before.
No, yeah, so for the past 2 or 3 days, I needed a brace and I had to have that tape that I took off. With the squats and the compression in it, I actually have a bad hip injury from sparring years ago. And I felt it kind of pulling over, shifting it into place with the squats. So as he took it off, I just feel my knee back into place kind of. And my hip as well, going down into the squats afterwards. This is crazy.
Because it all starts from the base, as your foot. So me,
and you were saying that this increases the range of motion.
Range of motion. Absolutely.
Now that's crazy.
So we're gonna do the other side. He received such quick results from this because of blood flow. Blood flow is the king of all treatment. If you can get blood into a certain area that's injured, that has damaged tissue, you are actually aiding that process because you're delivering the nutrients from the blood into that joint. It's super important. I was able to really get as much blood flow in that area as possible. It's exactly what he needed. The most things I see with athletes, compensation injuries. So arthritis, you start to get those little micro trauma injuries. A little sprain here, a little sprain there, then it impacts your range of motion and your strength. Range of motion is at baseline what you need. If you don't have the adequate range of motion, you won't have the strength to do what you need to do for performance. So that's one of the main things that I see from athletes.
And this is actually my bad knee. That's what my meniscus on this one. This is the first time I'm ever getting any treatment. Focus on that.
Focus really on here. So yeah, you're doing a squat, but you're really trying to bear weight. Enhance that weight bearing.
1, 2, 3.
All right, take 2.
He's the last one.
And 2 with the cover.
Yeah. The last one is that.
It's like a cool rush flow. It's like a cool rush. My leg just feels like it opens up and it can breathe in. It's kind of suffocating with the compression, but once he starts unraveling it, I just feel the motion start coming back. And I guess like you were saying with the blood flow, it also just starts rushing back, up and down. It's amazing.
What I'm gonna actually do is called the Grasson technique. It's actually a form of instrument-assisted soft tissue mobilization. First things first, I'm gonna use some rock sauce that has capsaicin in it, which will help with pain relief. But I also use that as a gliding for the tool. I'm gonna put some right here, just right on his knee. Just a little bit, doesn't need a lot. When I'm evaluating at the knee, one, does he have soft tissue, any soft tissue restrictions? He will immediately feel if he has any soft tissue issues because as I go through with the tool, we'll actually give him feedback that it's ridgy. And that ridgy or that crunch, it indicates to him and it indicates to me that, hey, I have some soft tissue, scar tissue limitations there. So that crunch right there, when you did have an injury, it didn't organize as well. So what I'm gonna do with this is I'm gonna go down on it and reorganize it. Reorganizing the scar tissue right here, it's gonna allow you to have more range of motion. It's gonna modulate your pain. So that means less pain, which is the goal of all.
Absolutely.
This is gonna help you with your performance and better recovery. And it enhances blood flow all at the same time. You can see that it's just way more smooth. My cadence with the tool, it's a lot faster. It's a lot smoother because the scar tissue is realigning.
This is my first time working with Bobby, and I've never experienced something like this before. This is definitely a new form of recovery. Yes, he definitely helped me out. I already feel more stable. I feel like I can go and take a walk without limping right now. It's doing something good here.
So this is actually GT1. This is for bigger muscle groups. What I'm gonna do is some gliding with his quad, and more so I'm gonna do the hamstrings, the supporting muscle groups of that knee. Make sure I cover all aspects of the knee. I just don't wanna treat the joint because without the supporting muscle groups, there is no movement. So same thing here, I'm putting the rock sauce on here just for gliding. And it's, like I said, it has that capsaicin for that pain relief factor. And down, this, and down. You're getting double gliding in that quad area, okay? So ready, up. Yup, don't worry about me, perfect. Yup, slower, there we go. Nice. Great. Great. You feel the ridgy, right? So you use your quads a lot, I can tell.
Absolutely.
So you can see here, his skin is starting to get a little bit red. That's indicating to me that he's getting blood flow. That's what we want. When I go up, breathe in. When I go down, breathe out, okay? Out. The hamstring is a big supporter of the whole back of the leg, the whole back of the body. Just the back of the body itself, people neglect. When people go to the gym, they're so, that's what they see in the mirror. They see their chest, they see their abs, their quads, but this is neglect. The quad and the hamstring, they work in unison. As you're loading one, another one is stretching, right? So once one side is stronger than the other side, you are more prone to have an injury. That's why you see LeBron James having hamstring injuries. They tear it, why? Because they don't strengthen it appropriately. There's no balance. So that's very important to notice about the hamstring. That you have to keep it just as strong as the quad. It may look simple as getting some type of tool like this and rubbing on your muscle, but it actually takes a little bit more expertise. In order to do so, you have to be certified by Graston. And in order to do that, you have to be a therapist or one of their credentialized professionals, healthcare professionals. But in doing this Graston technique, it's not as easy as grabbing a tool and putting it on there. You're analyzing the pattern of the muscle. You're looking to see if there's any scar tissue. How does that feel? What stroke do I use? Do I use a fanning like this? Do I go all the way down and just glide on the muscle? There's different techniques for different types of problem areas. That's why at Recover, where we are licensed professionals, doctoral level therapists. So he's telling me that he's experiencing some pain from the glute going all the way to the top of the knee, all the way there. So what I'm gonna do, I'm gonna actually hold it and pin and try to decompress that pain spot he's having right there. So the pain that he's having here at the top of his knee, there's a nerve that actually connects from the low back going to the medial side of the knee. So you may be experiencing pain on your knee, but that's not the root cause. So really trying to hone in onto the root cause is what is gonna help fix the issue itself. You've probably seen the circular bruises on Michael Phelps, LeBron James, the best of the best athletes. What I'm about to do is cupping. The faster the color change, the more compromised the tissue is. So what does that mean? That means he's either A, he's overusing that tissue, he hasn't got an adequate blood flow in that area, So you can tell here that that area is, like I said, it's compromised. You can see the color change as it's happening. It's starting to happen here. And the reason why we're doing it on the IT band and the knee is because, like I said, we want to get those supporting structures. Cupping has been in the mainstream lately, and the reason being, it all started back with Michael Phelps. Michael Phelps in the Olympics. He had these big circular bruises on the back of his, on his lats, and people were asking, "Whoa, is that the treatment that's making him such a great athlete?" And that's when it really started getting a peep, and you started seeing those different athletes with the cupping.
When I have all these cups on my leg, it feels like I have a bunch of ropes kind of pulling me from both sides, like if they were attached to my leg a little bit, increasing the pressure.
Blood flow, blood flow, blood flow. That's the reason why we're here. With recovery, you want to enhance that blood flow process, get it into the tissue, heal the tissue, so you're back on the field, back on the court, or even back in the boxing ring. A lot of people actually don't mind the bruising because it's kind of like a tattoo. It's kind of like a warrior scar.
Like a bragging right.
Yeah, like a bragging right. Yeah.
Oh, they showing them all. Chicks totally dig the cup bruising. They're all over it.
With my boxer trainer, recovery is everything. Especially with Doc here, he gonna get you up and running. No time.
My passion for recovery came when I was a kid. I mean, just being an athlete with basketball, I wasn't the most athletic, but I understood recovery from a young age. I understood that, hey, I might not be the most talented, but in order for me to go to the next level, to be a collegiate basketball player, and one day for someone else, a pro, I need to really hone in on recovery. You could be the most talented, but if you don't have the right recovery and your body is not as in shape, or you're not doing what is needed for recovery, you won't get as far. Your body will just break down. Rock Tape, they're partnered with the CrossFit Games. Their strips have way more force within them. Trying to decompress the knee or give the knee more stability, just with one strip, you already feel it from your brain. You know it's there. So I like to use it because it's good quality and it sticks on and lasts longer than other brands. The adhesive is so good that it's actually water resistant, the Rock Tape. I like to tell my clients that, hey, you should actually have it for 2 to 3 days. You can shower with it. You can have it on through any water sports, like I said. We tape it in flexion, in the most flex position. That's the proper way of applying Rock Tape compared to other brands where you just tape it, however. So right here, I'm gonna put a stability strip to give him some stability. Okay. He probably won't need to put on a brace after that. I'm gonna run another stability strip on the lateral aspect of the knee. So I anchor it. And same thing. I go all the way down. Okay. And then I'm gonna put 2 decompression strips. Or any congestion, it helps it open up so everything can flow through. Blood flow, blood flow, blood flow. So you have the finished product right here. You have a decompression tape here, decompression tape here to allow for blood flow to get through the knee. Then we have 2 stability strips here to give him the stabilization while he's performing out in the boxing ring.
Like I have full range of motion.
You have full range of motion, but you feel it like, okay, like it's there.
Yeah, it's holding me in place.
Yeah, it's holding you in place, exactly. Without having the restriction of a brace.
Yeah, definitely. With more range of motion.
Yeah.
Nice.
No problem, man. Yeah, got you.
Yes. Recover.
If you're interested in getting any type of recovery, DM me, Dr. Bobby Thrush, at IamRECVR on Instagram, where better recovery is better performance.